Sweating. We all do it, some more than others. We all sweat. It's natural. It's how our bodies cool down. But some of us sweat a lot, like really a lot. And it can be embarrassing, uncomfortable, and even get in the way of everyday life. If you're someone who constantly finds yourself reaching for a towel or worrying about pit stains, you're not alone. Excessive sweating is more common than you think. And the good news, there are solutions. There's a name for this excessive sweating, hyperhidrosis. Basically, it means your sweat glands are in overdrive. They produce way more sweat than your body needs to regulate temperature. Hyperhidrosis isn't usually a sign of a serious medical problem, but it can be a symptom of an underlying condition. If you're concerned about your sweating, it's always a good idea to talk to your doctor. So, what causes some people to turn into fountains of perspiration? Several things. Let's dive into the main culprits behind this often embarrassing issue. Sometimes it's genetics. Thanks, Mom and Dad. If your parents or close relatives sweat a lot, there's a good chance you might too. It's all in the family tree. Other times, it's triggered by things like stress and anxiety. These emotional states can send your sweat glands into overdrive. Ever notice your palms get clammy before a big presentation or an important meeting? That's your body's natural response to stress. Stress hormones like adrenaline can set off a sweat storm, preparing your body for a fight or flight response. Spicy foods. That fiery curry might be delicious, but it can also make you sweat. The heat from the spices tricks your body into thinking it's overheating. Hot peppers contain a compound called capsaicin that tricks your body into thinking you're overheating, causing you to sweat to cool down. Certain medications. Some medications list excessive sweating as a side effect. This can include antidepressants, blood pressure medications, and even some antibiotics. If you notice a change in your sweating after starting a new medication, talk to your doctor. They might adjust your dosage or switch you to a different medication. Medical conditions. In some cases, excessive sweating can be a symptom of an underlying medical condition like thyroid problems or diabetes. It's important to get checked out by a healthcare professional if you suspect this might be the case. Lastly, practicing good hygiene and using antiperspirants can help manage excessive sweating. Stay cool and stay confident. Section 4. Fighting the flood. Simple tips to manage sweat. Sweating is a natural process, but excessive sweating can be uncomfortable and embarrassing. The good news is there are things you can do to manage excessive sweating. With a few simple changes to your daily routine, you can significantly reduce the amount of sweat you produce. Start with these everyday tips. Choose the right fabrics. The clothes you wear can make a big difference. Natural fibers like cotton and linen breathe better than synthetic fabrics. They allow air to circulate, keeping you cooler and drier. Deodorant masks odor, while antiperspirant actually blocks sweat. Apply antiperspirant at night for best results. Stay cool and hydrated. Drink plenty of water, especially in hot weather. Staying hydrated helps regulate your body temperature and reduces sweating. Avoid triggers. If you know spicy foods or caffeine set you off, try cutting back. These can stimulate your sweat glands. Relaxation techniques. Stress can trigger sweating, so find ways to relax, such as deep breathing or meditation. Regular exercise can also help manage stress and reduce sweating over time. Section 5. Calling in the pros treatments for when home remedies aren't enough. Sometimes, despite our best efforts with home remedies, we need to seek professional help. If those tips aren't cutting it, don't worry. There are several professional treatments available that can make a significant difference. There are professional treatments that can help. Prescription-strength antiperspirants are often the first line of defense. These contain higher concentrations of active ingredients to block sweat. Another option is Botox injections. Botox isn't just for wrinkles. It can also temporarily block the nerves that stimulate sweat glands, providing relief for several months. It can also temporarily block the nerves that stimulate sweat glands. Iontophoresis is another effective treatment. This involves using a mild electrical current to reduce sweating, usually on the hands and feet. It's a non-invasive procedure that can be done at home or in a clinic. Surgery. In severe cases, surgery to remove sweat glands may be an option. This is usually considered when other treatments have failed and involves removing or destroying the sweat glands to provide permanent relief. Section 6. Don't sweat it too much. Finding the right solution for you. Remember, excessive sweating is a common problem with effective solutions. Don't be afraid to talk to your doctor about what you're experiencing. They can help you figure out the underlying cause and recommend the best treatment plan for you. With the right approach, you can manage your sweating and get back to living your life with confidence.